very much, Darren, for joining today.
Thank you for having me. Yeah.
Your research is so exciting. It brings me back to my McMaster days. I
hmm
actually did my master's in human biodynamics
Okay.
and was involved with, I think Marty Gabala had
Yeah.
just come.
Yeah.
And so to watch the work that you guys have been doing is just so incredible to me, and so impactful for women
Mm,
as we hit perimenopause in particular, and just female athletes in general.
right.
And so, there's a lot of chatter around creatine and the research around creatine and how it can help women. But if we take a step back and just talk about musculoskeletal syndrome of menopause,
hmm
thrilled to hear it get some legitimacy through the work of researchers like yourself and Dr. Vonda Wright. It's now, a legitimate condition or syndrome of menopause where you see some of the symptoms: decreased muscle bone,
Right.
decreased muscle mass, joint pain, a whole lengthy list.
hmm
And so share with us a little bit about, before we even talk about creatine supplementation, what is the role of creatine in our bodies as it relates to all of that?
Yeah. It basically acts as a safety barrier, helps maintain the energy currency of our cell. Most of your viewers are familiar with ATP or adenosine triphosphate, and basically, if Batman is ATP, Robin is creatine. And so they
Okay.
usually go hand in hand. And when you're performing activities of daily living, primarily at a bit higher intensity, that's where creatine really seems to come to the rescue, helping maintain the energy currency of our cell. And for the most part, when we talk about cells, we're talking about muscle. And our muscles have thousands of muscle cells called muscle fibers. And when we're exercising, weightlifting, running, sprinting, or shoveling the driveway here in Canada, those are activities of daily living that require muscle contraction and performance. And creatine's got its promise and prominence from basically causing individuals to get bigger, stronger, faster. And that's sort of exploded since the 1990s to now this global phenomenon where creatine isn't just for young males looking to get adaptations. It's essentially for anybody on the planet looking to get either exercise or functionality, or probably more importantly, some health benefits. So that's kind of how it is. It's naturally produced in our body. A lot of people don't know that,
Yeah.
but it's produced in the liver and brain. We produce about maybe 1 to 3 grams a day. You can also eat this in your diet if you select certain foods such as red meat and seafood. Now, vegans, vegetarians, and those on a plant-based diet, we can talk about some of the issues there. So again, you can naturally produce it. We can get a small amount in the diet. The issue is that the research is suggesting that more is likely better. So yes, you can get enough in the diet, but with the cost of groceries now, or if you don't eat seafood or red meat, it's very difficult. So that's why supplementation seems to be more prevalent for a lot of people when we think of creatine.
Yeah, I was going to ask you just that question, in fact, in terms of, can you eat enough meat
Or
to have enough creatine, or are we talking like, and in particular, we try to limit our red meat,
we
many of
think
us nowadays.
We
So,
think from a muscle perspective, you can probably eat almost enough. So, for example, if you're on an omnivore or carnivore diet, you're probably able to eat about 2 to 5 grams of creatine a day in addition to what you're making. And that dose is very viable. It's very effective for providing muscle benefits. Uh, the dose that's probably required to cause significant bone, immune, and or brain benefits, it'd be very difficult to get to the diet. And as you mentioned, what if you have allergies to seafood, you don't eat red meat or animal flesh, you're a vegan? The cost of groceries, supplementation, if it's safe and third-party tested, is very viable and cost-effective. Um, and we've evolved since the regular dosing. When you talk about doing your masters, back then it was probably 2 to 3 grams a day after something called a loading phase.
yeah.
And really, we don't even probably do the loading phase unless you're an athlete anymore, because that's
Okay.
where you can get some GI issues, especially for females, water retention, things like that. So we've
Yeah.
evolved in our mindset. Yeah.
Well, and so back in the 90s, I was actually really involved in weight training and doing
Right.
some bodybuilding competitions. I was the junior North American bodybuilding champion.
Okay.
And
That's
we,
awesome.
creatine came on the stage, and
Right.
we loaded the creatine and then
Yes.
we would take it. So that was one of the questions I had for you
Yeah.
in terms of, so, women starts to supplement it. Should she do that loading dose?
Yeah, so the loading is the most rapid, viable way to saturate your muscles really quickly. Like we're talking in as little as 2 to 3 days, but that's taking 20 grams a day, which is about 10 times more than what we're naturally producing. So it's a very effective way, but the downfall is when we see people take this, it can cause the number on the scale to go up by about 1 to 3 kilograms during the first 10 days. That usually subsides once your body gets used to it. But it can also cause a few anecdotal GI issues. We've heard of incidences of bloating or, some stomach issues there.
Yeah.
So the loading phase, we think, is very viable if you don't have any adverse effects, or if you're like an athlete, so to speak,
Right,
that needs a
right.
really quick fix. I think for any of your listeners considering supplementation and they're taking it for the health aspects, do not do the loading phase. You can
Yeah.
take a really low daily dose.
Okay.
That will eventually accumulate and you'll get the benefits. And you can actually do as low as 2 to 3 grams a day. It'll take several weeks to a month to get the same level of the loading phase. But at that dose, you're not going to notice any adverse effects. And the cool thing with creatine, the profile of the safety profile at the loading phase even is exceptional. So
Right.
there's nothing really to worry about. It's just how you want to achieve your results.
Yeah, it was really interesting to see really no adverse effects in the
No.
research as it relates to creatine.
Yeah, paper
But
just
knowing,
came out
if someone's going to buy a supplement and not see value, so knowing, okay, I don't need to do the loading is super helpful.
Yeah.
And we just actually had a debate on a whole channel of triathletes about, loading and not loading. So they'll be happy to hear this.
Yeah.
Sure.
It's interesting. The athletes can tolerate the loading because they're not probably cared about, the water retention that you get with creatine being osmotic is really beneficial for decreasing cramping, and it's super hydrates. But sometimes when you're in a weight conscious sport, and if you have an event, if you put on 1 to 3 pounds, maybe not a big deal, but in some sports it might be. Yeah. So for the average person, we don't usually recommend the loading phase unless you're specifically looking at brain benefits in certain circumstances. But the average person, I think you can start as little as 3 to 5 grams a day, and away you go. There's no big issues there.
Well, and really interesting in terms of research is coming quickly in this space, which is fantastic. Yeah. And so for the critics who, need a bolus of randomized control trials, how do we tease out, what's really good evidence for women as they age versus we're not quite sure yet. Yeah. And so if I kind of unpack it a little bit, do we have strong research to support, creatine supplementation for non-athletes can help with bone and muscle mass retention, basically, so not losing muscle mass?
Yeah, it's a great question. So let's preface it. Let's start with muscle. There's a few studies that show without an exercise intervention, creatine can improve measures of muscle performance, primarily strength, endurance, power, and recovery. That's primarily in young individuals, primarily biological young males. And then there's been a few studies in older adults. And I like those studies for one reason. There's a lot of aging populations that can't exercise from comorbidities, arthritis, disuse atrophy. Creatine can still cause some beneficial effects. They're not great, but they still can. So in certain circumstances, it is beneficial. The totality of research suggests that resistance training primarily, or weight-bearing exercise, unlocks the potential. Regarding bone, unfortunately, there's complete negative. Unless you exercise and cause that mechanical stimulate to the bone, there's never been a single study to show bone benefits with creatine by itself. Yeah. So I think if there's two categories. For those listening that can't exercise, you may expect very, very small beneficial effects from creatine, primarily maybe from a muscle performance perspective. But from a bone perspective, we're not seeing any benefits. So we're in the camp of exercise as the driver behind a lot of these benefits.
And in particular, that strength training, resistance exercise, right?
It has to be weight-bearing. Although we've actually now started to see the evolvement for the endurance athletes, the aerobic cardio, where it seems to be anti-catabolic, almost causing an anti-inflammatory. So allowing that athlete to get back on the field, the soccer field, train for the triathlon a little bit easier. It decreases cytokines or markers of inflammation. So it's interesting that creatine used to be just this anabolic compound. And there's some really good evidence in the animal and humans showing that it has anti-inflammatory properties, kind of like an Advil if you have muscle soreness. It kind of works
Okay.
like that, but it seems to have a totality of new ideas with it. Yeah.
Oh, that's fantastic. I
Yeah.
wasn't aware of the aerobic link. My teenage son was trying to steal my creatine. He's a
Yeah.
golfer. And I said,
Okay.
well, you
Yeah.
didn't do strength training today, so you don't need it. So we'll keep this away from him.
Yeah.
But yeah, that's good to know for sure.
Yeah.
And so, yeah, so understanding for women who are non-athletes or
Yeah.
athletes, creatine, there's great evidence to support the benefit for muscle maintenance, muscle growth
Yeah,
as
you
well.
got. Yeah, so lean body mass or muscle will go up. The best evidence for females is in combination with exercise for muscle performance.
Right, right.
But we're not seeing any benefits to the bone without that exercise. So at the end of the day, if you're an exercising individual and then you add creatine to it, you should experience way more benefits than someone who just takes creatine by itself.
And just shifting a little bit in
Mhm.
terms of how we should take it. So is
Okay,
there anything, so we don't need to dose, like we don't need to load in really unless we think we could tolerate it and really are looking for that boost.
exactly.
But is there something we should be doing in terms of time of day, not
Mm,
taking it with carbohydrate? Like
yeah,
what's the best way
yeah.
to take this
So
supplement?
two things come to mind. So the question often is, does it matter when I consume it or the timing? So the good answer is no, it doesn't. You can actually consume it whenever it's convenient for you. I do like to emphasize around close proximity to exercise. So before, during, or after. One of
Okay.
the reasons is in 1992, the most seminal study showed that when you exercise your muscle, it sort of unlocks the doorways to suck in a little bit more creatine a little bit
Right.
quicker.
Right.
So I think in close proximity to exercise is a very viable time. The cool thing is with creatine is you do not need to mix it just in water. You can throw it in yogurt or whatever you're eating. It's tasteless and you can get it that way.
Okay.
You don't have to consume it with a lot of carbohydrates. If you want, that's fine, but you don't need to. I think muscle activity is the best way. But if you say, you know what, I'm going to consume it with my breakfast and then supper 12 hours later, totally fine.
Okay.
Creatine needs to accumulate in your tissues, unlike caffeine, which will peak in the blood about an hour after. So the timing is irrelevant per se. Now, there is questions regarding the combination of coffee and or caffeine and creatine, and this is an important distinction. There
Right.
is research to suggest that the caffeine molecule and the creatine molecule do oppose each other. It has to do with calcium release and uptake in a certain area of our cell. So
Okay.
that could decrease muscle performance, and some exceptional researchers out of Europe have clearly showed that. But the caveat, and this is really important to note, the dose of caffeine in those very acute
Hmm.
studies was 250 milligrams or more. So most people say, geez, an average black coffee is 80 milligrams, tea is 40. So you would need to consume like large or extra large coffees and slowly drink those throughout the day to probably negate the effects of creatine. So I think it's totally fine to mix your creatine in your coffee, your tea, or whatever it is, as long as the dose of caffeine is not over 250 milligrams, which is almost impossible. Maybe there's a commercial large or extra large more than that. And then again, it has to be done consecutively for weeks and weeks on end. So creatine and caffeine do not oppose each other from a pharmacokinetics, but there is evidence to suggest that they sort of don't like each other from a calcium perspective for muscle
Okay.
contraction. I don't combine the two just
Yeah.
because since the timing of creatine is irrelevant, but the timing of caffeine is
Caffeine.
certainly important.
Yeah.
I just take creatine whenever I feel like it. Obviously, my caffeine or coffees before I work out.
Well, I mean, the coffee's all day long for
All
some
day long, it's
people.
always going. That's right. Yeah, exactly.
Well, and I read I'm shifting a little bit from
Yeah.
creatine, but I read your study about the Red Bull
Yes. Yeah.
in adolescence, and it got me into this whole deep dive into, because I always learned that there's good properties for exercise performance with
Right.
caffeine, and so I
Right.
was, kind of like interested in the result.
Right.
And so, hopefully a conversation for another day is
Yeah.
the
It's
world
always
with
a
caffeine.
slippery slope when you're looking at commercial energy drinks and giving 2 cans, and then yeah. So
Yeah.
we just wanted to see could the ingredients with taurine have an effect, and it had some small beneficial effects, but who's going to go out and buy 2 cans of energy drink and consume it each time? It's a little
Yeah.
nonsensical, but
Yeah. Well, and it's good to be able to share with the adolescents
Right.
that are doing it to say, your
Absolutely.
performance is not
Yeah.
really that significantly better by
No.
doing that.
Yeah. And then you got to look at the
Um,
long-term health implications. Yeah, absolutely.
yeah,
Yeah.
100%.
Yeah.
And just sort of in that stream, though, in your research with looking at nutritional interventions with
Right.
strength training, is there anything that you would add for the listeners about, thinking about, so for a lot of women, they're switching from strength training with lighter weights to learning how to do
Mm.
heavy load,
Yep.
but also coming at it from brand new. And so,
Yeah.
are there other nutritional considerations that you found in the literature are important for women to think about in addition to creatine?
Yeah, so the first one has to be adequate protein. We've now well represented that the RDA is embarrassingly low. And
Yeah.
I think you mentioned McMaster. So Stu Phillips is one of the world's greatest protein metabolism researchers. And he's come out many times showing that 1.2 grams seems to be a really viable amount that we should be striving for. They've done some elegant work suggesting that 1 gram per pound would be the maximal amount. So the first thing is exercise, as that's the cake. The nice chocolate icing is protein, and then maybe creatine is the sprinkles on it that cause someone to eat it a bit more. But do we think creatine can rescue an impaired or a poor protein diet? I don't think so. Protein is essential for survival, right? So we need that. And then there's a few others. So I think protein and creatine are in a category by itself from the health and the importance. And then you can add in the omega-3s, the vitamin Ds, especially if you're deficient. I know magnesium's getting a lot of press right now, probiotics. So there's a lot out there. Collagen, there's not a lot of promise behind it unless you're taking it for a specific condition, maybe tendon or skin health. But again, protein and creatine stand alone when it comes to the health. Performance is different. You have the beta alanines and the bicarbs. And for the endurance athletes, beetroot juice is the best next to caffeine. So there's a few, but I think from a muscle growth perspective, I think protein, and then behind that would be creatine from a synergistic effect. Yeah.
Well, and I love your analogy. It's similar to what we share with women. It's that get that base of the cake set, like get strength training in a situation where it's a habit. And then let's look at, and in partnership with the protein, because they do go hand in hand. And then then add the sprinkles of creatine, but don't sort of start with the sprinkles and then, so I like your analogy.
And the other thing is you can combine creatine and protein together. Like I throw so I take 10 grams of creatine at least a day. I'll put 5 in my Greek yogurt with whey protein in the morning. I'll drink 5 grams during my workout. That's an easy way for me to get 10 grams. Some days I try to take more. But if you combine it in a meal or in a smoothie or a shake, there's no interaction or interference effects of anything. Protein and creatine like each other, and you get some synergistic effects. Yeah.
And just to touch on strength training a little bit more, your research on older adults, looking at, I want to make sure that I get this right. So I'm just looking at a note that I made, like that lifting heavy.
Yeah.
Can you talk a little bit about that for our listeners? Because I know there's a lot of women that are afraid of lifting heavy and what that all means. But tell us a bit about that.
It's evolved a little bit as well. So the really nice thing is that any weight-bearing exercise to you will be beneficial. However, as we get older, and of course we're susceptible to sarcopenia, the age-related loss in muscle strength and functionality, the nice thing is if you're able to lift heavier things, you'll improve strength and functionality and of course lean body mass. If you're unable to lift heavier things, and when we say heavy, it's subjective. I can't say 80% of your max. It's just whatever you feel that, around the 7th or 8th repetition, you're starting to put in some maximal effort there. But again, going back to Stu Phillip and Nick Bird's work, they've showed that if you lift something light, that's okay, but you need to go to fatigue. And in other words, you can't just do 10 and say, I could have did 10 more. You kind of got to pick a light to moderate weight, but lift it until you can't do another muscle contraction. So that may be maybe 20 to 30 reps per set. And that has been shown to have the equivalent increases in muscle growth. So I know that's a bit hard to believe because people think if I lift heavy, that will make the biggest gains in strength and muscle growth. But actually, from a muscle growth perspective, if you lift lighter or heavy, but to fatigue, you'll get the same gains. But please note, if you like to lift heavy, you'll get a superior increase in strength. So I'm in the camp of try to lift things that are out of your comfort zone a little bit, as
Yeah.
long as it's safe. If you need to use machines, that's great. Machines are very effective because they stabilize you. You don't have to be out there doing free weight squats and things like that. If you can, they're better. But machines are good. Rubber tubing, anything that you feel is a mechanical stimuli to you. But the nice thing is you benefit no matter what. You're never too old to start. You're
Yeah.
never likely too young to start. But I agree. I think we got to get people in the mindset. The supplements come second. The foundation has to be exercise, and try to focus on things that you lift, because the cool thing with weight training is that gives you all the benefits pretty much of cardio, and then you get all the extra benefits from a muscle performance perspective and bone health. Yeah.
Not good news if you're a cardio addict, though.
Well, the other thing with cardio is you get phenomenal benefits. I mean, you're going to live long. The downfall of doing extensive cardio is muscle atrophy. You're always catabolic because the nature of the movement
Yeah.
is so daunting. Your protein requirements are high, but you do suffer muscle atrophy with a lot of cardio. So for those listening, please add in some push-ups, pull-ups, whatever you can to cause a bit of resistance to the muscle. You only need to do it 2 days a week. So maybe I might suggest to those people doing a lot of cardio, maybe every other day throw in a weight training session, maybe whole body. You'd be surprised the benefits that would help you with cardio. You're going to be able to run faster, recover more, because you're going to have more muscle growth and recruitment.
Yeah, and I would add you won't be surprised when you get an injury and you're
That's
taken
right.
out of the
Yep.
cardio.
Exactly.
So
Exactly.
I agree with you. After still dealing with the second hamstring tear, I'm
Yeah.
definitely strength training.
Yeah.
But also, I like how you said it's just fit it in,
Yeah.
starting to do something and then
Yes.
building on it. I'm not I struggle to go to the gym. It's not something that I used to do a lot of it. And so now, I go to Pilates,
Yep.
which I use the reformer. So it doesn't have the same benefits of heavy strength training, but I'll do that a couple times as a treat. Then I'll do heavy weights and just mix it up a bit.
And I
So
think the
find
key
stuff
is,
that you like that you'll
yeah,
actually do.
and 100%, the vast majority of the population does nothing. We drive
Yeah.
to work, we come home, we watch Netflix all night, and so the first thing is, if you're able to do something, you're way ahead of the curve, and that's phenomenal. We want you to
Yeah.
live longer, free of disease, and nothing will replace exercise. Like, it has
No.
to be there. Move as often as you can, record your steps. If you can carry groceries, if you can walk up the stairs, all that adds up at the end of the day. And
Yeah.
in today's society, it's so stressful, but if we can just make people live longer, free of disease, and have one less stressor by being able to do things on their own, I think that's very beneficial.
100%. And I love when you said, like, just get moving. So I
Yes.
think too, there's a lot of people who think, like, I fit my workout in, I'm done, check.
Yeah.
But if you
Yeah.
actually break down how much energy that 45 minutes to an hour did, and you're sitting at a desk all day, well, if you sort of change your mindset
Mhm.
to let me move as much as I
Right.
can,
Yeah.
you'll be really, really surprised at what you can do. And, even just a 10-minute walk
Yeah.
after you eat will stabilize your blood sugar. Just keep moving as much as you can, really.
Yeah, and recent researchers at UBC have shown these exercise snacks. And so if you see a set
Yeah.
of stairs or two flights and say, okay, there's the elevator, but I've been sitting all day, walking 2 flights of stairs adds up. You're getting muscle contraction, your heart rate goes up. So at the end of it,
Yeah.
all these things can add up, and you might not think of it because you're at work or activities
Yeah.
of daily living. And if you add that into your normal exercise, you're going to get profound benefits. I agree. Yeah.
100%. 100%.
Yeah.
Okay. Well, thank you so much for your time. This has been a really great conversation and very practical for people to learn more about, how to strength train. Do I need creatine or not? If I'm going to, what should I do? So I greatly appreciate your time. And hopefully we can talk about caffeine and other things another time.
That's right. Yeah. Thanks for having me. Appreciate it. Thank you.